Hi, Miss Bishop. How are you today?
Doing good, how are you?
Good. I'm Chase. I'm going to be your student nurse practitioner. Okay.
Okay.
So, tell me what brings you in here today.
I'm just here for a general physical checkup.
Okay.
Also been experiencing some mouth pain. I had oral surgery 2 days ago.
Okay. Sure. We'll address that in a little bit. Okay.
Thank you.
So, so you're here for your annual physical.
Mm-hmm.
Okay. Is there anything new health-wise that you would like to address? Anything been going on?
My tooth pain. I've been taking medication that the dentist gave me, but it's not doing anything to knock out the pain.
Sure. Okay. Okay. So I'm just going to go over some past medical history and some family history with you. Okay.
Okay.
All right. Any childhood illnesses?
The chicken pox, but I mean nothing out of the ordinary.
Good. How old were you when you had the chicken pox?
Oh, I was in 3rd grade, it's about 8.
8 years old?
Mm-hmm.
Okay. Have you had any recent shingles infections or anything? Have you been getting them?
No, I have not.
Oh, okay. Any childhood injuries with or without complications?
I was pretty accident prone, so I broke my right wrist when I was about 7.
Mm-hmm.
I had a compound fracture of my left elbow when I was about 9.
Okay. Left elbow. Okay. And any complications at all with the, I take it you had surgery on your left elbow?
I did, yes.
Okay. No complications at all? Were you hospitalized for that?
I was in the hospital about a week. They had to do pin placement,
Mm-hmm.
and then when they removed the pin, were some complications with the pin placement, and so I had to have another surgery. So I was required to keep my arm in a cast for about 9 months. So I had physical therapy resulting from that.
Okay. Any infections involved at all with that?
No.
Okay. No infections. And have you had your childhood immunizations?
Yes, I did.
Okay. Do you get your yearly flu shot?
I should be better about it. I got it while I was pregnant, but other than that, I
Don't really get it.
don't really get
Okay. Well, we can certainly set you up for something if you'd like.
Okay.
Any recent TB tests or exposure?
it. No.
No.
I haven't had a TB test since 2010.
2010. Okay. And what about your tetanus shot? Have you had one in the last 5 to 10 years?
Feel like I have, but I can't remember when. Like maybe it was about 10 years ago.
Maybe 10. Okay. What about your measles, mumps, rubella vaccination?
I was up to date. I took all those.
Okay. And have you been hospitalized recently for any infection?
Infection, no.
No? Okay. Have you had any previous surgeries as an adult?
I just had the 2 teeth removed to have implant devices placed.
Okay.
Had those both removed.
Both on the top?
One on the top, and then the one's my very back molar. I think
Okay.
we called it tooth 31 and tooth 4.
Okay.
And then I had my tonsils removed when I was 18, so about 16 years ago. I had a surgery on my left wrist. I had a ganglion cyst removed. There's one more surgery.
No? So you had the
Oh, and I had
teeth?
one wisdom teeth removed, all 4.
All 4 of them?
And
Okay.
then
I guess you got that when you were a child.
No, I had that when I was 2006.
2006. Okay. 2006. Okay. So I'm going to go a little bit of personal history with you. Any diagnoses of high blood pressure,
No,
diabetes,
no,
any cardiac disease,
no.
any childhood asthma or current asthma?
I'm allergic to cats, and so when I was around them, I worked at a vet clinic, and when I was around the cats, I would sometimes get asthma attacks, but it was never really chronic, but I did have a rescue inhaler just to be safe.
Okay, we'll certainly go over that a little bit more, okay?
Okay.
And no previous TB exposure, correct?
No, not that I know of. I've never tested positive.
Okay. And no history of heart attack, stroke, seizure?
Nope, still standing.
All right, good. And no, what about liver, kidney function issues?
They're still rocking and rolling. Still got them.
All right. Okay, so do you take any medications on a regular basis?
Not on a regular basis. I try to take a multivitamin when I can remember, but nothing regularly.
Okay. What about the medications? Are you taking any for the oral surgery that you had?
Yes, I'm taking 37.5 milligrams of tramadol, and then I'm alternating that between that and about, I think, 600 milligrams of ibuprofen is what they gave me. And then I'm also on a 10-day dose of amoxicillin 3 times a day.
Okay, do you know what the dosage is on that?
I didn't bring it with me, I'm sorry.
It's okay. What about the ibuprofen?
Ibuprofen, I think it's 600 to 800, and I'm alternating that with the tramadol.
Okay. All right. And back to your allergies. You said that you're allergic to cats.
Yes.
Okay. What about any food allergies?
It's a little weird. I have an allergy to anise. It's kind of like a herb, if you will, like a spice. I've just noticed anytime it's in a food, I get tingling and swelling of the tongue.
Okay.
Other than that, no, just that and cats.
Okay. So that and cats. Any environmental allergies? Do you have seasonal allergies?
No. Moving up here, I'm not allergic to cedar or anything like that. So, no.
Okay. Good. Okay. So I'm going to go a little bit over your family history. Mother and father, any siblings?
I have one brother.
One brother. Okay. And are your mother and father still living?
They are.
Okay. How old is your mother?
My mom is going to be 58 this year.
58. Okay. Does she have any significant health history at all?
I think she was diagnosed with osteopenia, so like the pre-osteoporosis, but she's been managing that very well with diet and exercise, I think, but nothing critical.
Yeah.
She also, both my parents are British, so they're known for being, prone to skin disease. My mom had skin cancer removed from the bridge of her nose, maybe like 8 years ago.
Okay.
And then my dad had a skin cancer removed from his back.
And your father did as well?
Yes.
Okay. Are they in the sun quite frequently?
My dad works for oil companies, and so he's been in the sun his whole life. And then my mom, she's a sun worshiper. She's outside in the garden. She's out swimming. So they didn't use the proper sun care like they should have.
Okay. And any significant health history with your father? I know you said he had the skin cancer.
He's borderline high cholesterol.
High cholesterol.
He's managing it. He doesn't take medication for it.
Okay. Tell me about your grandparents on your mother's side. Are they still living?
They both are, yes.
Okay. And how old is your grandmother?
Whew. She's got to be about 78 by now.
78. Okay. Any significant health history with her?
She had an abdominal aortic aneurysm detected about 6 years ago.
Triple that. Okay.
She had surgery done for that, and it just had horrible complications, sepsis, infection. She had to have one of those little bags, like a colostomy bag attached after that. She's just been pretty miserable ever since.
Okay. Does she have any health history as far as high blood pressure,
she has COPD and emphysema.
Okay.
Yeah.
Does she smoke?
I think she still does, yes. She's smoked all her life, and she quit for a while during surgery, but she's still smoking now.
Okay, so COPD, what about high blood pressure?
Don't know about high blood pressure.
Diabetes?
No.
She ever had any strokes?
No.
No seizures?
No.
Okay, and what about your your grandfather on your mother's side?
He had a double hip replacement maybe 15 years ago, and now he's battling glaucoma. And he just recently got diagnosed with myeloma. It's a blood cancer.
Okay.
I only found that out about a month ago.
All right. And what about any aunts and uncles? Any significant health history as far as have they had skin cancer as well? And high blood pressure?
Not to my knowledge. I got a bipolar uncle, and my other uncle was born with a cleft palate, but I think I'm past.
Okay.
Worrying about that.
What about your brother?
My brother, he's great. He's 30 years old this year.
Okay, 30. And any significant health history with him?
No.
No? Okay. All right. So tell me about your personal history. Are you married?
Yeah. Did you want to know about my father's grandparents? They're both gone. I didn't know if you still need their information though.
Yes, thank you. Tell me about your father's parents.
They both passed away really early. My dad was 9 when his mom passed away, or 11 when his mom passed away, 19 when his dad passed away. She had a fear of doctors, no offense, and she died of pneumonia complications. And then my grandfather, my dad's dad, died of a heart attack, heart disease,
Maternal
when he was
grandfather.
about 52.
He had a heart attack at 52.
Mm-hmm.
Okay.
I never met either of them. They've been gone for a while.
Okay. Thank you very much for that. Okay. And so, are you married?
I am.
Okay. Tell me about your husband. How long have you been married for?
It'd be 5 years this March.
Good.
Mhm.
Everything's going good.
Yeah, it's great.
Okay. Any kids?
We do. We have one son. His name is Bodie,
Mm-hmm.
and he is going on 20 months old.
20 months old now.
Mhm.
Good. Healthy little boy.
Yes.
Awesome.
Rambunctious.
Good. All right. Anything else that you'd like to address regarding your family?
No.
All right. Okay. So, what do you do for a living?
I work for the Texas Department of Public Safety in the crime lab. I work for the
Mhm.
breath alcohol testing section, and I serve as their quality manager.
Okay. Good. Would you say that's a pretty stressful job? No.
No, it can be from time to time,
Okay.
but it's manageable.
Okay. Good. And if you did have to cope with any stresses, do you feel that you have adequate coping mechanisms at home?
Oh yeah, I've got a
with
great
the
support
family?
system at home with my family,
Great.
friends.
Awesome. Good to go. Okay. So do you live in a house or an apartment?
I live in a home.
Okay. Do you rent or own?
Own it,
Okay.
part of it. Still have a mortgage.
Good. And do you identify spiritually, if you identify at all?
No, I don't.
No? Okay. All right. Do you have adequate friend or family support system that?
Plenty of family
Yeah.
support, some friends, but the
Yeah.
ones I have are very close. So yes,
Good, okay. All right. So do you drink alcohol at all?
yes. Like I
Okay.
said, I have a 20-month-old son.
Ah, understood. How much do you say you drink on an average basis, daily, weekly?
Been trying to cut back a bit, but I'd say at least 3 to 4 glasses of wine a week.
3 to 4 weeks?
Usually I'll put it all in one day, but
Okay, that's fine. Do you smoke?
no, never.
No? Okay. Any illicit drug use?
Nope,
Any previous drug problems?
nope.
Good. Okay, and tell me about your dietary habits.
Not the greatest. I'm getting better.
Mhm.
So I don't usually have as much time as I'd like to cook dinner at night. So I'm susceptible to fast food and quick, easy choices. But I am trying to get better.
Okay, how often do you say you eat fast food a week?
2 to 3 times.
2 to 3 times?
Been definitely cutting back. It used to be a lot more.
Okay. And do you exercise at all?
I do.
Okay.
We have a great gym at the where I work, and so I usually try to get there at least 3 times a week. And last Monday I joined Camp Gladiator. It's kind of like a boot camp style they
Good.
do outside. So I've done that. Tonight was my 3rd class.
Okay. Third
Mhm.
class. Good, good. So you're getting back in the gym and
Yeah, trying to.
getting healthy. Awesome. Okay. So do you frequently experience any common ailments? Do you frequently experience fever, nausea, vomiting,
No,
constipation, diarrhea?
not on a regular basis.
No? Okay. What about fatigue?
Other than dealing with the baby, no. Not,
No?
Yeah.
Do you say you get adequate sleep?
I do. I'm pretty good about going to bed early to make sure I get at least 7 hours.
Okay. Have you noticed any rapid increase or decrease in weight?
Define rapid. No.
Okay. All right. So, no frequent headaches, any dizziness?
No, none.
No. Okay. Any memory loss or confusion? No. Okay. Good. All right. So, any hearing loss?
No.
Not that you notice. Okay. Any pain in the ears
Other than the radiating pain from my mouth, but I know that's just
from the oral
from
surgery?
the oral surgery.
Okay. What about visual changes? Any pain in or around the eyes?
No, I wear contacts, but for the most part they don't bother me, except for right now it's really dry and itchy.
Okay. Any double vision
No.
noted at all? Okay. No blurred vision. No. What about dry eyes?
Every
Frequent
now,
dry
every
eyes?
every now and then, but I sometimes blame the contact lenses. I just need to switch them out. I have glasses I can wear as a backup.
Okay. Now, any nasal congestion where you have trouble breathing out of your nose
No,
frequently?
not regularly.
No. Okay. What about frequent sore throats? Any pain in the throat? Difficulty swallowing?
No, I mean I'm still having that radiating pain right now, but it's not. I don't think it's my throat.
Okay. Good. So, have you experienced any recent chest pain, chest tightness? Maybe it feels like somebody's sitting on your chest.
No.
Nothing. Okay. No palpitations.
What's that?
It kind of maybe feels like your heartbeat is a little irregular. You know?
Oh, yeah, no.
Maybe
I
it
don't.
speeds up or
No.
slows down.
Only when I come home and look at my husband.
Oh, look at ya. All right. And you've never been diagnosed with any clotting disorders or irregular heartbeats?
No.
No. Okay, good. All right. No pain in the legs after long car drives, after flights. Have you had any?
I always blame it
Pains.
on my family, but I've got like a chronic bad back, if you will. I do have to always watch like bending and stuff like that, and if I sit for long periods of time. But I'm really good about stretching and knowing when my back's about to go out, and I try to work on that. So
Sure, we'll certainly address that a
Okay.
little bit. What about pain in the legs, maybe after a long flight?
no,
No, specifically behind the knees.
no,
No, and the calves.
Nope.
No. Okay, good. All right. Okay. Have you had any recent trouble breathing, severe coughing, congestion, coughing up phlegm or mucus? No. Okay. And about your childhood asthma that you had, do you take an inhaler for asthma
no. I just
frequently?
now I just avoid cats, and that way I know I'm away from it. If I know I'm going to a friend's house, I'll take medication beforehand. But for the most part, I haven't had an asthma attack since I was 18.
Okay. And how severe would you say those asthma attacks were? Would you have to be hospitalized
Oh.
for them, or take an
Yeah,
inhaler?
very very mild. Usually a few puffs at the inhaler, and I get away from the cats, and I do fine.
Okay, good. So have you had any recent abdominal pain, tenderness,
No,
nausea, vomiting, diarrhea,
no.
constipation?
The Tramadol, I think the doctor said that could be a side effect, so I have been experiencing a little bit of that, yeah.
Okay. Are you on any stool softeners right
No,
now?
I'm just trying to drink plenty of water and stay hydrated to
Okay.
deal with it.
We can certainly address that as well. Okay. Any blood in the stool or abnormally dark black stools?
No.
Okay, good. All right. Any pain while urinating? Any blood in the urine?
No.
No burning sensation while urinating?
No.
Okay, that's good. Any discharge at all?
No.
Okay, good. So what about any new aches, pains? You had mentioned that your lower back
Yeah.
frequently hurts?
Yeah, I've just been known I can throw it out pretty easily. But I always say like inherited it from my family because my mom has the same back issues. But I'm really good about stretching and just trying not to overexert myself. And I can feel when it goes out. I've got a brace and
Good.
just do to apply heat and try to stretch it out.
Sure, and we can certainly address that as well. Now,
Okay.
was this from a previous injury that you sustained?
No, just
A car wreck or anything?
I mean, I've been in a couple car wrecks, not very bad though. But no, it's just I've had it all my life really from the time I was a teenager.
Okay, well, how's your range of motion? Are you able to bend down, sit up okay?
Oh, yeah.
Okay, can you twist and turn?
Oh yeah.
Yeah,
can do that.
everything's just fine there?
Mhm.
Okay. All right. Any new skin irritations, rashes, new lesions, bumps,
No,
lumps that you'd like to address?
nope.
Okay, no abnormal new growths or anything?
No.
Okay, good. And have you ever had any unusual swelling, say, under your arms, around your chin area, in your neck? Any tenderness anywhere
No.
around there? I know the mouth surgery
Yeah.
could certainly
Yeah,
throw
but
that
no
off a
lumps
little
or
bit.
anything like that. No.
No tenderness under here,
No.
under your arms,
No.
not in your groin area.
No, sir.
Okay. Okay. And have you ever experienced any suicidal ideations?
No. Pretty happy. Pretty happy.
Good. Any depression at all?
No.
Good.
No.
Good.
Pretty happy person.
What about sleep disturbances?
When I was younger, in my 20s, I used to take Lunesta to go to sleep.
Lunesta.
Yeah.
Okay, and what was the issue that was making it hard to sleep?
I don't know. I really think it was when I was in school. I just could never shut my brain down. I'd go to bed and think about all the things I had to study and what I had to do the next day. I could never shut my brain off. And so I used to take that. I stopped taking that in 2011.
Okay, so no night terrors, no disturbing dreams, anything like that would keep you from sleeping.
I had night terrors as a kid, but as an adult, I can avoid it. I just don't watch anything scary.
Okay, no scary movies.
No scary
Good idea.
movies.
All right, and Miss Bishop, do you have any questions for me?
No, I don't.
Okay, good. Well, we'll get on to our physical exam here shortly, okay?
Okay.
Just stand by. And thank you very much. That includes our health history examination. And no questions for me. We'll go ahead and get started.
All right, I appreciate
All
it.
right, thank you very much.
Thank you so much.
All right.